I'm excited now to turn to Dr. Cherie Collins-Sims to offer an analysis of our conversation this afternoon, as well as to take us into our question and answer session for the day. Again, just as a reminder, please continue to add your questions to the question and answer box. We're fielding some of them live and others will be asked during the session. As an introduction, Dr. Collins is the Chief Strategy and Innovation Officer at Prosperity Now, where she leads enterprise-wide strategy, performance, and impact. In this capacity, she oversees the organization's programs, policy, research, and field engagement efforts to ensure strategic alignment. Dr. Collins-Sims holds a bachelor's in social work from Lemoyne-Owens College, a master's of science in social work from the University of Tennessee, and a PhD in family social science from the University of Minnesota. Dr. Collins-Sims, I will turn to you.
Wow, thank you, Ivory. I have been listening intently and deeply, and I have to say I am impressed, wowed by the youth panelists. I was reflecting back on my time at that age and stage, and thinking about the task and the feat to have the courage to be on a call with hundreds of people sharing their perspective. So I just want to take a moment and give kudos and to give honor where honor is due, because they are not the next generation of leaders, they are the leaders of this generation, and just want to honor them and acknowledge them. Second, as I've been listening intently, boy, there's lots of notes that I have here as I think about what has been said thus far across all of our panelists on this discussion. And I just want to make sure that I capture a couple of pieces before we move into the question and answer session. So Ivory started us off with the question of why do inequities persist in communities? And our panelists, earlier panelists, as well as youth panelists, have given us several things to consider as in terms of why inequities still exist, but they also have given us some potential solutions as we think about how do we transform our current state into a new ideal imagined state where we're not talking about inequity anymore. So the first point that came up several times in the discussion was that inequities exist because the issues are longstanding and they're rooted in racist systems, policies, and practices. And that in order to really address inequity, it's going to require a systems response, that we can't program ourselves out of inequity when it's rooted in systemic failure or systemic inefficiency. If we continue to try to program ourselves out of it, then we will only simply continue to mitigate the effects of a broken system that doesn't work well with everyone, work well for everyone, and that we're at a pivotal moment at this point in time to begin to address the root causes and to seek solutions that are systemic in nature by transforming the system as it exists now to a system that imagined health equity and equity across all of the domains that I've laid out when we began the conversation. Another point that came out in the discussion that I think it's important to lift up is that we also can't understate the role and the power of all social institutions. Oftentimes when we think about systemic challenges and systemic issues, we immediately go to big systems, what I would call big S system solutions. But what we've heard so eloquently positioned by multiple panelists is that there are other social institutions, including the family or household level, as well as the community level, that are innovating, that are theorizing, that are summarizing and collecting and analyzing data in a way that can actually lead to change in ways that we have not imagined when we only think about it from the big S systems lens. This is also important because sometimes when we drive to more of the government system or the economic system or the education system or these kind of broader systems, we run the risk of, I believe it was Shavana who talked about unintentionally stripping the healing bomb, the natural healing that happens within communities, the natural healing that happens outside of traditional systems. So we want to be very thoughtful in how we're thinking about systemic change and systemic solutions that we're thinking about across all social institutions, and not just traditional big ass systems changes that we've historically thought about. I think the other thing that really stuck out for me as I listened to the discussion is being very, very careful about whether or not we are solving for issues with communities or solving for them. That it is incredibly important to think about how we partner with, as well as engage community in meaningful ways, whether or not we're respectful of how they're talking about issues, how they're solving for issues, and how they are persevering in garnering their resilient characteristics to be able to solve for issues within their own community, and how do we be thoughtful and mindful of that in the process. This leads to kind of a broader theme that I continue to hear throughout the discussion. And it actually started with Melody, which I appreciated her sharing her story. And it really was about voice. And really thinking about who has the voice to identify and frame issues as well as solutions. We heard that with Dr. Carroll as well, as she talked about data and the voice of Indigenous communities in data. And as I was listening to Melody, and I think it cut across many of the themes, there were a couple of points that I jotted down, and it was the power of voice from within, that the power of voice from within gives the ability to tell the story. It also gives the ability to engage others in the story. It also gives the ability to connect with others around your story. And I was particularly noted that when Melody, as you spoke about your ability to use your story to connect with the teams that you work with. It also, paying attention to the power of voice within communities, also empower others to tell their story. And you communicated that eloquently when you talked about the role of Dr. Joyner in your life and in your story, and helping you shift and to empower you to tell a story. But I also think we saw that modeled here in the youth panel discussion, because oftentimes, we think about how do we include people at the table who have historically not been at the table. And we often forget that when you're not historically at the table, you need support to sit at the table. You need to be equipped to sit at the table in meaningful ways, because there are conversations that's happening around you, about you, because of you, that you have not always been privy to. And I think we saw that modeled here today, Melody, as you facilitated the youth discussion. So it was great that we were able to invite their voices to the table and encourage them to share their perspectives and stories. But the extra nudges and the extra pushes that you gave for them to elaborate on their story and to feel empowered to share more about their stories is incredibly important as we move forward. And finally, as the theme about voice was really about when you're able to empower the voice within, there's the ability to shift the story in the narrative of those both within, in terms of how they see themselves. And I think about the message that Dr. Joyner gave to you in that moment, Melody, but also how it shifts the narrative of how other people see them as well. And I go back to some of Rufus's points and Dr. Carroll's point, and even Latour's point around, there's something about being able to provide voice and provide context and provide perspective that really impacts not only what's happening within community, but how other people see what's happening within community. And I was really moved as Dr. Carroll, you talked about data sovereignty and the path that you laid forward. And I continue to ask myself, what if we were able to adopt that sort of approach when we're thinking about work with BIPOC communities across the country? What if we're able to really deem community members as experts, as owners, as contributors to data processes and owners of their own data and their own story? And what if we elevated their narratives, their story and data in a way that we elevate the data and the stories that appear in peer-reviewed journals, or the data that is in the stories that make it to mainstream media, et cetera. But there's something about that what if we reimagined community in this moment that will help us solve for the inequities that exist within. And I'll end with my remarks around the inherent tensions that I heard. So it'd be great. Yes, there's these inequities, and yes, there are these possibilities, but many of the panelists outlined a number of the inherent tensions that exist when partnering with, engaging with, and leading with community. Andrea really did a nice job of laying out the example of even when you have grit and perseverance, and even when you're leading with innovation, without the networks, without the power, without the resources, without the platform to really make a difference within community, without the reach to elected officials, without the reach to decision makers and other systems and institutions, it really becomes difficult to move an agenda. And so there's a need to both balance out that grit, perseverance, and what's happening at the community level with what really moves systems, which is power and resources. There's also in that theme, and you came back and cycled around to it, Andrea, again, which was, it's not just about resources as it relates to, again, traditional means and approaches, but it's also lifting, resources that will allow us to lift up those things that have been outside of mainstream, those alternative systems and solutions that have served to help BIPOC communities when they have historically been left out of systems, but also can help us seek to transform the system overall to work equally well for each other. So that resources question not only becomes about mainstream systems change, but also those alternatives that, in my youthful language, hold communities down when the larger system does not work for them. This came up when Rufus talked about it. And I think it was inherent in a number of people's responses. But even if you push for community engagement and systems change, there's just a reality that in communities of color and those communities that have historically been marginalized for all of the reasons that were listed above, that there's an inherent distrust of the system. And so when you are working in partnership with community, not understanding or taking for granted the distrust that would exist, even with well-intentioned means, is going to be incredibly important. I was just reading a news story yesterday. We've mentioned COVID-19 several times on this call. And as we gear up for the vaccinations, there's this reality in communities of color of whether or not this is safe. Can we trust it? And so as we think about health equity, as we drive towards that goal, is incredibly important to understand that even in the best of solutions, there's that distrust. And then finally, as I bring my remarks to a close, I have two final points. One, there's this question about barriers. And there was a broader question that was posed in reflection about barriers as it related to youth leading in this work. And it's easy to assume that a lot of the barriers that they face will be kind of age-related alone or experience, et cetera. But if we remove their age in their experience from the equation. And we just take the essence of what they discussed and shared here today. The barriers that they have talked about are the barriers that exist in communities of color as we try to drive towards a more equitable future, whether or not you're sitting as a nonprofit organization leader, whether or not you are a grassroots organizer, whether or not you are a family member trying to figure out how to solve for the implications of policies in your everyday life, that the barriers are much larger, and it drives back to the point that this is systems, and that we need to focus there. So as I close, I want to actually close with, Shavonna, your words. I believe Melody asked a question like, in terms of what are you doing in your community to address or to think about how to address health equity. And your exact words, and it was quite moving, was when you said the way that we are leading. And I want us to take that away as we transition to the question and answer session, which is the way that we are leading. You said we are not our trauma. We're leading in a way that we're promoting the solutions and the healing bombs that are out of mainstream and traditional to who we are as a people. And so I want to close with the way that we are leading, and how are we each leading in this moment, not as just a youth panelist, but all of us on this call as we think about how to solve for health inequity in communities across the country. So I just put myself on mute. That isn't helpful. So I'm going to try to do a couple of different things. I know that there were a few questions that were in chat. I want to start with one that was connected to the youth panel, because I just left there. The first question was, what are the state level accountability mechanisms to ensure that elected officials support anti-racist policies? By one, ensuring the policies are in place, funded, and then implemented effectively. Two, that community voices are included in decision-making. And three, that elected officials are called out if and when they make decisions that go against their campaign platforms. Andrea, you actually raised the issue, but I want to give you an opportunity to respond to it if you have any particular thoughts around it. But I also want to open it up to all panelists if there's a particular response to what are the state level accountability mechanisms that can be put in place to ensure that elected officials or driving with such an agenda and holding them accountable to the communities in which they serve.
So yeah, that's an excellent question. That one's always one that I start really asking myself, usually within like a month or so when, you know, post elections, after somebody's gotten sworn in, it's how can we make sure that, you know, they keep whatever promises that they made on the campaign trail. I am always very much in favor of just do not be afraid of actually contacting them. I am certainly never timid about like contacting a local or state official's field office because, you know, they work for the people. They work for whatever district elected them, the state that they are accountable to. And when it's come to, you know, just kind of coordinating and organizing efforts with other organizers, activists, or even just like standard community members that haven't really come out before for a previous action, you know, bringing up, hey, like this, you know, this bill is coming up. Actually, most recently, it was a few months ago, you know, environmentalism is always a big like issue when it comes to like California. And we were seeing that there wasn't a lot of action being done in terms of like, well, how are you going to improve just like air quality and water quality in Southern California? And we actually did look up, well, how did our elected officials vote on this assembly bill and this state Senate bill? And we coordinated effort to, well, let's call up their offices and let's see what kind of explanation they will give for why they voted the way that they did. Especially for those of us that did campaign for them, or also when those votes hadn't been done yet, it's calling them up and saying, well, how does this assembly member plan on voting for this? You know, they did, you know, promise that they were going to, you know, fight every step of the way to make sure that air quality improved across the state of California. We're seeing high rates of childhood asthma. We're seeing just, you know, smog rates continue to go up. What is going to be done? What is the follow through? So yeah, that kind of direct approach, always great, especially because some elected officials, you catch them a little bit off guard, and they kind of forget sometimes, like, oh wait, I do need to be held account. Like, but the people who voted for me, the people who campaigned for me, the people who are, you know, it's going to depend on them if I get another term. That's who I need to answer to. So yeah.
Thank you. Yes, go
in on that as
go
well.
for it.
I think, this is Rufus Williams. I think that's a wonderful question. And I think it's one that we need to ask and ensure gets answered much more frequently. You know, here in Chicago, we have a Black mayor, we have a Black state's attorney, we have a Black county board president, we have a Black attorney general, we have a Black lieutenant governor. And somewhere in all of this, we would expect that our lot should be better. And we have to, just as we vote people in, we have to be very clear on the fact that we can vote them out. People who we would expect to carry the things that we think are important don't always do so because there are a lot of other things that are there. But I think we have to call for those questions very early in the terms. So just as people came by to see us when they were looking and soliciting votes, we need to check on those things early and check on those things hard and make sure that we're getting what we hope to be the advantages that would exist when we were giving our vote. You know, we're looking at that now when we look at, the question was asked about the local level because all politics are local, but we paid a lot of attention to what was going on the national level in this most recent election. And, you know, we have to be very clear, as Andrea said, be very clear on what our expectations are and what the power and the cost of our vote actually is.
Thank you so much, Rufus. I actually want to draw people's attention to the question and answer session because there was a section of the chat. There was a question asked about at the national level, and I know you responded there, but for the sake of time, if I want to draw people's attention there, and if any of the other panelists wants to respond to that question, I encourage you to do so in chat. So I want to make sure I get to at least two other questions that that was asked. So Laturo, earlier on in your remarks, there was a question that was asked about income disparity. So the question was, health disparities seem to be directly related to income disparity in the Gini coefficient. What is the best way to correct this measure?
Thanks, Sherry. I think that it's a complicated issue. Wages, I mean, typically incomes are not something that move quickly. Generally, they're in this country, they're related to wages, what your job is, what career you're in, what all those things are very place specific. And so traditionally, what I would say is there's a local approach and a national approach to these questions. Locally, you know, advocating for better jobs in communities, you know, a fair living wage, all those kinds of things increase wages for folks working. So those are all things that are being done and need to continue to be done. Small business creation is another major source of income and wages for folks. And then just having a social safety net that would that can take people from place to place when something like a pandemic hits a community. And we've seen kind of the impact that income supports or the lack thereof can really impact people. So I guess my point here is that all those things need to be done. And the advocacy around those issues, whether locally or at a national level, which we do mainly, are really to promote policies that will support people's incomes, either their wages, through job or small business, or transfer payments. The other thing is, particularly with health, stuff like ACA and access to health insurance, removing barriers to access health insurance, which has been fought tooth and nail under the Trump administration, is stuff that makes health disparities worse. And so for us anyway, at the national level, it's making sure that we reverse that trend as best we can. And that's a local voice and a national voice to say, we demand it. And so there's going to be, I think the issue here is, it's been a fight. It's been an issue that the communities across the country have faced for a long time. There are people locally find creative solutions, like job training programs that really target individuals who really need something, need a new career path, small business creation programs, and then overlaying some of the just a natural human right to have health insurance, which is a policy we started to go toward, and hopefully will return there. So I would just leave it at those kind of elements of it. It's a complicated question, but it has both a local approach and a national approach.
Thank you so much. And I want to pick up on something I said earlier about the what if with Dr. Carroll. What would it look like if we took what you shared today and thought about it across various communities of color? So I want to ask you, what are the implications of the Indigenous data sovereignty for other communities, especially other minority communities and marginalized communities? If you can take that one.
Yes, thank you for that question. It is one that we often get around thinking through the care principles for Indigenous data governance, primarily because most of the ways that we practice, even those of us who do community-based work and community-driven work, the scaffolding we have around us don't support collective vision and collective values and responding to, the greater than one. And also have difficulty, and we see this in COVID research now, understanding how an individual makes a decision to participate, but what does that have to do with their community? And how do we leverage community to build trust in systems that are built by us? And so I think the visioning in terms of how Indigenous rights to behave in certain ways, right? To have the right to be engaged, to have a right to sit at the table, to have a right to have resources and access to education, can be more broadly applied to other communities, is very timely. And I think one of the best things that we say is that by creating mechanisms that respect different rights of collectives to be consulted before research is done, to have community groups being the lead on research, and to have potentially move to a view where, so I spoke about our common rule, right, for research that doesn't have collective rights in it. It doesn't even address Indigenous peoples in it. And these are the guiding ethical principles and regulations for how we do research here in the US with human subjects. And so by beginning to think through how we might engage Indigenous collectives to give permission for research, if you go into tribal communities, you begin to see changes in the ways that we might think through how researchers have relationships with other communities too, and the responsibility that's inherent in the system and then becomes required. And so I don't personally think we're going to change the common rule anytime soon to address collective rights or to address the rights of Indigenous peoples, but the ways that federal agencies practice and the ways that research universities practice and the ways that hospital systems practice, we can begin to affect change within those systems and their policies about moving beyond consultation to actually seat at the table and driving the questions and the concerns of the community to the forefront.
Thank you so much. I want to go back to Shavana. Let's see, I want to make sure I'm still, can everyone hear me? I see Dr. Carroll has paused, so I'm assuming you all can hear me. I want to go back to Shavana. There's a question that says one area that seems to be missing from the discussion of health is mental health in the positive sense, as well as mental disorders and crises. A research field of social and political determinants of mental health is just beginning. And young people are responding would ask about their mental health and what can be done, changed to improve it. The question is directed towards how does the Culture of Health program addresses mental health, but I wonder if you can share some insights around how the Culture of Health program might think about addressing mental health as it relates to young people.
Yes, so I can answer this in so many different ways, but I think my main focus is alternative coping mechanisms for Indigenous people specifically. And I just like to be respectful and only speak on what my lived experience is, but I know it affects all people of color. As an Indigenous woman from a matriarchal culture, I like having a safe space for people to come to us with unconditional understanding that what we have been through cannot be understood from a colonizer point of view. We don't want a colonizer coming into our space and telling us what's valid and what's not. There's so many misdiagnoses. Oftentimes, our past psychiatrists have always just given medication. They have never given outside coping mechanisms, because when you go home and you don't have your doctor there with you, you're alone with those thoughts, those feelings. So we like to really encourage people, the people who come to work for us, to understand that we are a sovereign nation and our people need alternative coping mechanisms when they're home to deal with addiction, to deal with mental illness, to deal with cancer, in forms of tea, herbs, cedar, our water from our river. There's just so many ways that I could answer that, but I think that's one way that we can improve, and I want people to actually hear us and make a difference in our communities, that we can build for traditional coping mechanisms, learning how to create those spaces for healing, whether that's through sweat, through paddling in our canoes because we're ocean people. That question really got me excited. I like that question, so thank you for that.
Thank you, Shavana. And I am looking at time. I believe we have time for one final question. And I want to turn my attention to Melody, because a part of the theme in this discussion is not only why does inequities persist, but what are we doing on the ground to shift them, and the role that youth play in that. So my question to you as we transition is, how can adults and youth create shared leadership opportunities that bring forth bold solutions to health inequities, particularly in disadvantaged communities? So how can adults and youth create shared leadership?
So actually, I would probably use the, thank you for that question, Sherry. I would use the warehouse as a great example. The warehouse, we have a model of 4 teens by teens. And that model means that everything we do is in true collaboration with the teens that work alongside of us at the warehouse. They are the ones who work with the architect to create the design and setup of what the warehouse looks like. They are the ones who work with the interior designer. They are the ones who hear pitches from program partners. So in order for a program partner to facilitate any programming in the warehouse, they have to pitch their concept to the teen executive committee, and then the teen executive committee makes a decision on whether or not that program should be in the warehouse. So to answer that question overall, it is truly making sure that we have what's called a youth adult partnership with the teens and young people that we all have an opportunity to work alongside. The more that they are actively, as you had said earlier, Sherry, at the table, but also knowing how to be at the table and lend their voice to issues that matter to them, the more that we can have these collective youth adult partnerships where we can look at youth and really say, you know what, they are the ones who know what's best for them and their peers. And sometimes adults don't have all the answers and don't get everything correct all the time. And if we want them to be active participants in the change that they want to see in their community, then we have to make sure that not only they have a voice, but that they are participating and engaging in conferences and panels like this, but that they are at the forefront. They're creating the questions. They are the ones who are facilitating. They're the ones who are on these steering committees. So that way it is dynamic and that the youth and adults have an opportunity to share collectively together.
Thank you for your response. Thank you for all of the questions and questions in the question and answer box in the chat. I am trying to fuel and make sure that I've gotten all of those covered. I think I did to the degree that I could in the time that we had. So I am going to hand the conversation back over to the Culture of Health team to close us out.
Thank you so much, Dr. Sims, for facilitating this question and answer panel. Thank you to all of our panelists for your thoughtful responses and your engagement in our conversations today. The presentations and conversations are powerful reminders of the work that has been done, is currently underway, and still to come, to ensure that we are addressing the root causes of inequities, including structural racism and the unequal allocation of power and resources. We grounded our conversations today in an understanding of why inequities persist, and we look forward to our conversations tomorrow to explore models that are working to address health disparities and reduce inequities. We look forward to having you join us at 4 p.m. tomorrow afternoon if you are able to. But before we depart, thank you, Julie. It's up on our screen, our day 2 and day 3 sessions. Before we depart for the day, I do want to invite each of you to participate in a final poll everywhere and share what discussion or topic from today's conversation resonated with you. So again, up on your screen is the question. You can go to the pollev.com website or respond via your text. And I want to thank again the panelists, our facilitators, and each of you for joining us. We'll leave this we'll leave this poll everywhere up on the screen and look forward to receiving your sessions. And we'll end the Zoom at 6:30 on the dot. Thank you again for joining us. Have a wonderful evening.